hello to all the expecting mothers and mothers-to-be. I'm Dr. Gaana Sreenivas, Consultant Obstetrician and Gynecologist, Rainbow Hospitals, Bannerghatta Road, Bengaluru. Today, I'll be giving a little information on one of the most common but one of the most distressing and irritating feature of pregnancy. Yes, you guessed it right. It's called nausea and vomiting in pregnancy, popularly known as morning sickness, though there's nothing morning about it. So once it kicks in, the world gets to know that you are pregnant. But with it, it brings the distressing feature and takes away the bliss of early pregnancy. How common is it? Around 70% of women experience nausea and vomiting in pregnancy up to 3.5 months, whereas the rest 10 to 15 experience some amount of discomfort all throughout their pregnancy, whereas the rest 10 to 15% land up in complications. So why do we have this? What causes this? Ladies, once you're pregnant, there's a hormone called HCG that is produced in your body. So this HCG triggers the vomiting center in your brain, and that's the reason you puke out. So if you are pregnant with twins, imagine more HCG, the more the discomfort and vomiting. Along with it, other hormones like estrogen and progesterone cause some amount of quiescence or discomfort in your GI system. Also during pregnancy, your GI system or the sphincters get relaxed. There's more delayed gastric emptying. Once the sphincter gets relaxed, you will have this feeling of regurgitation or something that's coming out, stuck in your throat, heartburn. So all of these are features. Along with it, the most important cause is fatigue, lack of sleep, lack of tender loving care and attention seeking. So the most common question, does it affect your pregnancy? No. The good news is no, it does not affect your pregnancy. But if you starve because of this, definitely you will land up with complications. So I'm going to tell you a few top tips and tricks how to endure this irritating feature and how to get a smooth pregnancy. The first one, do not starve. Eat small meals at regular intervals. Also, right before going to bed, do not take light meals. Get a sumptuous, nutritious, heavy meal and then go to bed. Avoid spicy, oily, fried food, butter, ghee, all of these. Kindly avoid the spicy food also. The most important one, remember liquids. Liquids are easy to go in, easy to come out. So people, they tend to think that drinking lot of liquids during this nausea and vomiting period will help them tide over the dehydration. No, that's wrong. People try to drink lots and lots of fluid. As a result, they vomit lots and lots of fluid. So stick on to toast, crackers, something dry fruit that is going to stick in your tummy. The other thing, some smells which you were attracted prior to your pregnancy, maybe your husband's cologne or dal tadka, petrol smell. So some of these smells starts to trigger vomiting center. So know your triggers and avoid them. It doesn't mean that you should avoid your husband's, but that's just one of the facts of it. The other thing is home remedies. So you can try ginger. Ginger is supposed to be the best home remedy to bay off this nausea and vomiting. Ginger ale, ginger water, and also the lemon peels and the orange peels help to decrease this nausea vomiting. Some women even try acupuncture wristbands. So whatever works for you best, go ahead. One word of caution to the family. Pregnancy is a big thing in a woman's life. Please give her the amount, tender loving care, this attention that she deserves. So this will help her tide over this 3.5 months. So coming back to complications, so as I told you, nausea vomiting doesn't cause any complication. But if you starve, definitely it is going to cause complications. So if you are vomiting too much, you'll have decreased appetite. Once you have decreased appetite, you're going to starve more. And this starvation will cause something called ketone bodies. Again, you will have vomiting. So this vicious cycles goes on and on. How do you break it? Let the vomiting do its job. You do your job. Eat, do not starve. Eat anything, eat small meals at regular intervals, so that is going to decrease most of the complications. Last but not the least, vomiting in pregnancy can be controlled, managed and kept easily at bay, right, with home remedies or with basic medications. Do not get frightened of this. We are always there to help you. Have a safe pregnancy and a great pregnancy ahead. Thank you.